Good evening and welcome to tonight's edition of The Probe. Tonight we delve into the realm of healthcare and its critical importance to our beloved country, Ghana. Our focus tonight actually revolves around one of Ghana's most significant initiatives in recent years, the Priority Health Infrastructure Project, also known as the Agenda 111, which was birthed and outdoored on one of the presidential addresses during COVID-19. So 101 district hospitals, 7 regional hospitals, and 3 psychiatric hospitals in Kumasi and Tamale. We'll focus a bit more on it and then other teething health issues. So this week, we are focusing on this because we know that the minister's press briefing, together with Dr. Anthony Nsiah-Sarrey, who is my guest tonight on the show, they've been talking about the number of projects. Interestingly, on the 29th of June, we know that they mentioned that 88 out of the 111 hospitals are under construction. But in the 2023 budget, it's captured that 89 district hospitals are under construction and 2 psychiatric hospitals out of the 111 hospitals under construction. So which is one of the key questions that we'll be addressing as well. And then we know that the district hospitals, 101 of them also in that budget. And then regional hospitals, 7, and then psychiatric hospitals, 3. This is what we are supposed to be looking at, the project definition overall. So this is the number of hospitals that makes up the 111, makes it the Agenda 111 that we are hoping to finish. We'll take a look at them and where we are with each of them. But let's talk about the project funding itself. Overall, we know that the Ghana Investment Infrastructure, that's the GIF fund, are supposed to be giving us $100 million, which that's one of the main source of funding for this. And then in the 2022 budget, there was an allocation, 518 million Ghana cedis. So these are, so far, the project funding, the sources, that's what we know. 100 million from GIF and 518 million from budgetary allocation for 2022. What has it gone into so far? He's here, he will tell us about it. And then the estimated cost, according to the Project Implementation Committee, chaired by the Chief of Staff herself, each unit of the project will cost $17 million. So that's what it's supposed to cost. Each unit is $17 million. And then the 111 hospitals is estimated to cost about $1.89 billion from the estimates that we've been giving. 17 million for each unit. So put all together for 111 hospitals, it's supposed to cost $1.89 billion. Has anything changed? Is it more? We'll get to find out this evening. And then also, according to the committees for the project's implementation, each hospital is expected to be completed within 12 months, starting from the point of commencement. Are we sticking to this particular timeline? Has anything changed? Earlier, we were told by the president that it was supposed to finish before the end of his tenure. It was then changed to the end of this particular tenure, which is supposed to be 2024. A number of projects are underway. Are we still sticking to the 12 months? Recently, they were in Trader, for instance. Let's take a look at the Trader situation. This is the very first of the project that was launched by President Akufo-Addo in August 2021. This is the Trader project. And recently, we're told it's about 61% completion, and it's been 21 months now, 21 months for Trader project, and it's just 61% of completion. Let's see how it goes. We'll talk about all that tonight as the Presidential Advisor on Health, Dr. Anthony Nsiah-Sarrey, takes his seat with us here on The Probe. We'll delve into these issues and more right here on The Probe, live on the Joy News channel. We're also on Joy 99.7 FM together with a number of affiliates. We're on myjoyonline.com and all our social media platforms. Make sure you do send us your messages with the hashtag The Probe. I am Emefa Apau. After this quick turnaround, we'll get talking. Please do stay with us.
Came to come and see what is happening here, and then we'll go back, brief our principals what has happened here, the progress of work we have reached, and then the contractors will tell us exactly if they are ready to finish by the end of the year. And if there are any problems that any contractor is having, which will mitigate the completion of the first batch that we want to finish by the end of this year.
We say anything than being so grateful to His Excellency the President, and we hope that the rate at which the contractors are going, he will be invited here to do the needful by way of commissioning this for us.
So my impression is that there's much improvement from last time we came here in September till today. And I'm very certain in my mind that this is one of the projects which will be completed by the end of this year. And we equip it for use by the people of Ofuase Achimans.
We want to come here and see. Say, Ochicheno, Oma, Ibisu, yes. Na yes, I have tried to say, if you be a right, because you are at the money by body. The sorry, here. Then, when they didn't call me, and I can't call the banner. And I know that one.
We are at the accommodation area. Actually, the contract was awarded to DBS not long ago. Initially, it was with a contractor, which we had issues with him, so his contract has been terminated. Now, DBS came to the site, I think 2 weeks ago. They've started the foundation for all the buildings. As been done, the foundation is ongoing.
We are very much impressed with the work which has gone on here. All the three contractors are doing well. The initial challenges, as the consultant said, was the rain of the land. If you look at the external work that they are doing, there are some rocks that they encounter. They have to break the rocks and then excavate the rocks and fill it so that they can get the levels that they need.
The next phase of the procurement will be for the insulation and then the roofing sheet itself. When we're able to clear that, then all the other works will start internally.
You're welcome back. This is The Probe here on the Joy News channel. We also on Joy 99.7 FM. For radio audience, I'm sure you were hearing a bit of the music and then also the talk in between. We're actually bringing you snippets of the project as they taught them this week. And Dr. Anthony Nsiah-Sarr and the team were on the ground, starting from Trede. They've been to Trefo. I know they've been to Asin North, Birim South, Trede. Like I said, Asin Crosso. There's been Gomua East, Gomua Central, Asin South, Ofuase, Mpoho, Ningo Pram, Sege, and Atimpoku. We'll be looking at some of the project, but he's in the studio for us to ask all the nagging questions about this particular project, and then we'll talk about other related matters on the health front. He's a presidential advisor, Dr. Anthony Nsiah-Sarr. Once again, welcome to The Probe.
Thank you, Emifa.
Thank you so much for joining us. So, at the last count, how many project sites did we visit this week?
Thank you very much, and good evening to all our cherished viewers and listeners. We started the monitoring on the 30th of May. We started from Apegoso near Timpoku, in the Sujamayan district. That one is under Zone 3. You know, the project has been divided into 8 zones. Each zone has averagely about 12. Zone 3 has 14 sites. And I'll come to Zone 3. Why? That's where a lot of the sites we don't have land, or we have very small land and the others. So we started from Apegoso near Timpoku. And the same day, we also visited Ningo Pram and Sege, which is under Zone 4.
Okay.
And then we moved to Abumusu, and out there, so the following day. We broke for 1 week, and then went to Zone 2. Zone 2 has 11 sites in Central Region, Eastern Region, and Western Region. I'm happy to say that all the Zone 2 sites are working perfectly well. In fact, the sites we have gone so far, out of the 44 sites in those 4 zones, we've visited 33 of them. We visited all the sites in Zone 2 because they are all actively working. We visited 3 of the sites in Zone 3 because Zone 3 had peculiar issues of land size, land terrain, and there are some of the places that there are no land at all. For example, Kokomremre, Nungwa, and the rest all fall within Zone 2. So those where we have very small land, because we needed 15-acre land, what has happened is that we taken a second look at it, and we are doing a double stack building. The drawings, architectural drawings have completed. They've done the bills of quantities, and they've gone through PPA because the cost has changed a bit.
Okay.
So it has to go through PPA again for approval. The contractors have been called to sign their contract and then move to site. There are sites which have topographical issues. For example, at Adesu, I remember a group of people from the minority select committee on Hennessy went there. They encountered massive rocks underneath, and they have to cut and cut. We also went there, we sorted out the issue.
Did we not know before that project site was actually allocated for that?
There were some geological studies. But depending upon the depth that you are going, according to the technical people, and you encounter rocks, and the rocks are not the type of rocks that in the Bible we say they can build on rocks. If they are very fluffy rocks, it's very difficult to build on it. But they've managed to secure about 9 acres of the land. And when we went there the last time, it can fit the original one-stack building, which the contractor has to go to site and then start working.
Okay.
So the 88 that we said, after we finish going rounds, I think we will know the number of sites which are active as we speak now. Then from there we went to Zone 2, which has 11 sites in Eastern Region. We started from Eastern Region, passed through Central Region, and ended in Western Region. And Zone 2, all the sites are working. I'm very happy to say that Zone 2 is doing very well because they didn't have any site issues, apart from a few of the sites that they have to do some cutting. We know when the president announced this in August 2020, where the consultants told us that the nature of the construction will be in such a way that because there are different contractors. In fact, one site can have, some of the sites have 4 contractors. Some have 2, some have 3. It's only a few who has 1 contractor as site. So it's shared among these contractors. And if one contractor is not performing, they become a risk contractor on site.
Okay.
So going around, we've spoken to all the contractors, and everybody has gone on site. And we don't shy away from terminating the contract.
Termination of contracts. I know that you've terminated a few on your rounds.
Yes.
Does it not raise issues about financial loss, because we know that they've been on this for quite a while, and then issues about future judgment debts amongst others? Are these all been taken care of?
Fortunately, the 3 contractors that you have taken them off the contract, they are mainly in Zone 8, which is in Ashanti region. They are one of the contractors.
Okay.
Most of them have done the 10% mobilization that we give them.
Okay.
So they don't owe us, we don't owe them.
Okay.
And one thing about this contract is that we put in performance bond. So even if you have not done the 10% mobilization that we have given to you, we fall on the performance from the insurance company.
Okay.
So that's a safe net that we put around this thing. You see, if you look at this contract, it was well thought of in the room. So we have done equipment packaging because we have realized that equipment procurement is a lead time. So we are starting the equipment procurement so that it falls within. When we finish, you don't have to leave the hospital for some time before commission, because we want to commission the hospitals and then move the health workers in. We've also did even planning for the health workers which will be working there. We know the number of doctors who will be working in each hospital, the number of nurses, the number of pharmacists, and the rest.
I'll come to this particular issue about the human resource, the nurses, and because I know that most of these facilities are specialized. Isn't that the case? They're specialized facilities.
No, this is a first referral center, so district hospital. Maybe we have gone through the type of hospitals that you have. I think you mentioned it. There are 101 district hospitals for all the districts without hospitals. There are some of the districts which will have 2 hospitals. Because at first we knew that 88 of the districts, out of the 260 districts, didn't have any semblance of hospital. But later we also realized that there are some of the hospitals that we said they are district hospitals which don't fit into the WHO criteria of district hospital. That's why we added on to become 101. And then there are 2 psychiatric hospitals. We call it 2 regional psychiatric hospitals, 90 beds. The district hospitals are 2 types. For the smaller districts, 60 beds, but the facilities will be the same. And the municipalities are 8.
When are we starting the psychiatric facilities?
Psychiatric facilities have started.
Okay.
There's one in Tamale, as you speak now.
Tamale and Kumasi.
Tamale
started?
Tamale is going to serve the northern belt. And then the one in Kumasi is sited at Omi in Ejoso municipality. We went there when we went there on Friday. The site has been cleared. The contractors are holding the site and they are starting because they have also problems.
They just had the clearing of the site stage.
Clear the land and then they are going to do their foundation. Immediately they finish the foundation, the hospital comes up quickly. That's the reason why it has delayed, because we didn't foresee the issues of land and all these things. Getting land is even a problem. Some of them took us to court and they have to go and talk and go to court and they remove the case from court. Because we asked the district and municipal assemblies to give us unencumbered land, which is 15 acres. And it's difficult to get 15-acre land in the municipalities and also in the metropolis. So that's the reason why we have now also done a second drawing for a double stack, which can fit on a 7.5-acre land, half of it, which we are going to do mostly in the metropolis. In Accra, when we went to Zone 8 in Kumasi, for example, Bantama, we have cleared the land. And then they are going to start immediately. Sokore Mampong, we have also done it. They are going to start immediately. Abrakwao in Obuasi East had a very difficult issue with the terrain of the land. So many rocks, the land slopes, it's just like a hill. So they've shown us another land, which the contractor will move to site on Monday to clear the place and start the foundation and then start. And then we also went to Adansi Akrufum. It also had issue of land terrain. Luckily, they've been able to clear the land, foundation have been done, the contractors are moving to site to continue. So if you look at all these things, so already 4 sites are coming to be added on the Zone 8 sites. So that instead of only 12 of them be working, there will be 16 of them all working.
It appears that we have a lot of excuses when it comes to this particular project, because from the very onset, we knew that we need land for this, but 21 months down the line, if we are still getting excuses about land and the topography and the nature of the land,
we sorted all of them out.
Okay.
I'll give you an example. If you go to Adijama in the Ahafuano southeast, they have to cut the land continuously for over 9 months because it was so hilly, and they have to make it flat so that we get a very flat. Because if you look at architecture, a very beautiful hospital, very state-of-the-art hospital, free air, free light, and everything. You see that the roofing is even butterfly shape. So and then there's even a courtyard within the hospital for patients who are mobile to move out instead of lying on the bed.
Okay.
So it's a special architectural drawing, and it was one drawing fit all. And that's where the problem came in. That's why we went back to the drawing board to make sure that we can have a modification in the structure so that we don't lose the architecture of it, we don't lose the functionality of it, but you can then have it a double stack so that they have the land.
Okay.
So I agree with you that maybe, yes, we should have thought of all these things before coming out.
And giving the timelines that you
And if you remember, I'm sure I saw that you were saying that it's 12 months. No, there are different timelines for every contractor. The contractor who is doing maybe 11 blocks has 18 months. The contractor doing another one has 15 months.
So what was the timeline for Trader, for instance, when it was launched in 2021?
The Trader, when we did on 2021, Trader also had cutting issues. They have to cut a lot.
But we knew there were cutting issues when we gave timelines about 12 months. I know Trader was giving 12 months to complete.
Not 12 months. 18
How many?
months.
18 months.
Remember the president?
And we are 21 months down the line.
Remember the president said 18 months. The president came again and said that he was over-ambitious in one of the State of Nation address. Or I think
it was for the entire project,
yes,
not just Trader.
Yeah, but the entire project, what the president meant, or what we meant was that when the project starts and everything is moving on very well, we don't expect the contractor to spend more than 18 months before finishing the construction.
Okay.
That is it. Trader, yes, they have to ask for extension of time. In contrast, we can do that. When there's
How much extension did they ask? Because even 21 months, we've done 61%. Are we still within the timeline?
The amount of work left to be done, the percentage will be higher because external work is a very high percentage. I'm not a building engineer or I'm not an architect. What I've learned from this work that we are all been following, that you get a lot of high percentage when you are doing external work than building. The most important thing is the substructure. Once you finish the substructure, the buildings start going on. And we also encountered a problem. We wanted to use earth bricks. Then we saw that it's going to be a problem getting the material. The material is there, but getting the expertise to make it such a way that it is all the same size and everything was a problem. That's why we all went around it and then decided that those who are having problems, and there were only few people who could do it, you should go ahead and use the blocks.
But as you are extending this project, at least you are extending the timelines, does it mean that the cost also may go up?
No.
The cost stays?
The cost stays the same.
It's still 17 million?
Except the ones that we are going to do, the double stack. The cost goes up, especially when you do...
We are interested. So with Trader, for instance, how long are you hoping... No. How long the timeline? If you're extending, you said there'd be some extension.
When we went round to the 33 sites, that's
by 2024, are you hoping that Trader will be completed?
So if everything goes well, the construction will complete, God willing, by the end of the year.
At the end of this year.
In fact, that is what we are trying to do. We want to know the number of sites which will finish by the end of this year, the number which will finish by the end of the first quarter of next year, and then last batch will be by the end of the second quarter of next year. So that by the end of quarter 3 in 2024, we are hopeful that all the ones that have started, we have a land, we don't have any issues, we can then finish it. And as His Excellency the President said, that he would like to at least commission, and Ghanaians will get a feel of it by the time that he leaves office on the midnight of 6th of January 2025. That's what we are working towards.
Okay.
And then we will come here again to tell you when we finish our rounds, which will complete in the middle of September. We will be doing press conferences in any zone that we go, because we are moving together with all the people who matter. Okay. If Ministry of Finance, Ministry of Health, Ghana Health Service, the users, Ministry of Information, the monitoring team unit of the Office of the President, and
the committee itself. But clarify for us. I don't want to leave the audience out of it because there are a number of questions that I've seen from them. Clarify. In the budget, I see 89 district hospitals. That's what we're supposed to be putting up. I'll read details for you and then also raise the issue about the prioritization out of the 101. Why these particular 89 districts that we've prioritized to start with. But really, what is it? 89 or 88?
The prioritization, you see...
We'll talk about the prioritization, but clarify for me, the numbers, 88 or 89?
The prioritization of the construction is done by the construction itself. It's done by the contractors.
Okay.
We haven't said that we are doing this one and leaving this one. It's the amount of work that contractor does. Any contractor who works brings certificates, called interim payment certificates, and we pay. Okay. So once they get more money, they put it in. I'll tell you...
we're supposed to do 101, but you are doing 89 so far, at least from the budget, 89. But from your tour, at least the minister's press briefing, I was told 88. So I want to find out the shortfall. Where is the other one?
88 because I've told you that a place like Adesso, they have to stop.
Okay.
So in the 89, Adesso was part of it. Adesso was part of it. But because they have to stop, and then they are starting again, that's why we say 88.
Okay.
But if you look at the budget time, Adesso, the contractor was there doing the excavation, the cutting and the grading. So it was added. That's the reason why the one difference.
Okay.
But as I said, by the time we finish all the rounds by the middle of September, We will tell you specifically how many are started.
Okay.
We haven't prioritized any place above.
Because I was wondering, because the budget talks about 89, but we know it's supposed to be
Yes.
one
So that's the
district.
difference.
So why do we prioritize this 89? Is there a particular reason why these 89 have started and the others have not?
No, so that's the reason. I've given
Okay.
you the reason. But as I said, others will be added so that to come into the same as the budget that the Minister for Finance did. So we did that one because they asked us how many sites are working when the budget was being made. So we told him that there are 88 sites which contractors are on site.
Okay.
But as I told you, others had a similar problem. So we are going back for this week. That's what we are going to do with the Ministry of Finance to make sure that these are the sites which are all working. Show the pictures to them. They've already had the pictures because their Ministry of Finance was with us. And then we know what we will do. But I want to quickly tell you that this is for the construction of the works. We are now thinking, and we'll be together with Ministry of Finance to look at the way that we are going to put equipment into the equipment procurement. Yeah, a lot of options for equipment procurement nowadays. We can do leasing, we can do placement, we can do outright purchase. We are thinking about all those things, and we want to know the one and pick the one which, or it will be a mixture of them, which will be very useful for us and also serve our purpose.
Okay. Dr. Nsensare, what would you say to people who may have said that, at least looking at all the challenges that we've encountered over the period for this, at least there are certain things that you didn't expect to have happened, at least the rocky areas, some of the excuses that we've heard about why some of the projects have stalled. Do you think that this particular issue about the Agenda 111 was clearly overhyped, you'd say?
I won't say so. What I would say that this is one of the very major, massive infrastructure development in health in the world.
In the world?
Yes. I don't believe that anybody gets up and say that.
Let's interrogate that. Do we have a human resource development plan in place for these projects when it's completed?
We have it.
Let's test that.
We have it.
Let's talk about it.
We know the number of doctors.
Knowing the number of doctors and nurses that are leaving the country in the numbers that they are leaving, you have a plan in place?
We have a plan in place. Averagely, we need about 120, 150 clinical staff or health staff in each of district hospitals. There are about 2 or 3 batches of nurses who are waiting to be employed. They all get jobs to do. Every one of them.
Hopefully they don't leave the country before then.
Yeah, I mean, hopefully, I'll say hopefully, because you see, what is happening in the world nowadays, in Ghana doesn't have what WHO needs. There's a threshold where the developed countries can actively come to Ghana and I would say employ people without any formal arrangement. That's why they are doing it through agents. In Ghana, we are lucky that we are training health professionals, especially nurses. There are about, the last time I counted, there are about over 80 nursing training schools in this country. Each one is training. The last time I counted, there are 5 medical schools and also 2 private medical schools. So there are 5 public medical schools, 2 private medical schools, which makes it 7. All what you need to do to take advantage of what is happening now in the world, to open up, expand. Once you expand, it means you have to expand the training. One of the most important...
Which is something we are doing here?
Yes. One of the most important things in, for example, health training, institution training, is the practical aspect of it. Because health training, medicine, nursing, pharmacy, is not only theoretical. There's also a practical aspect of it. These hospitals we are putting up in the districts is going to assist to decentralize the training and then add more students to it. So that KNUST can use all the new hospitals which are coming up as training sites and appoint adjunct lecturers and adjunct professors and senior lecturers at those places. It will also help us to also decentralize our postgraduate training so that let me tell you, doctors, for example, don't just go out there to go and work because maybe it's because of money. Every young doctor, which I've been one of them before, wants to be a specialist.
So and that's the concern. Yeah, specialized personnel, training of these specialized personnel is one key concern at least.
Yes. So we should have a lot of hospitals where we can decentralize the training and then we don't disrupt somebody who has his family maybe in Ho. That's where he's working. He has a wife and children there. And all of a sudden, he has to come to Korle Bu, leave where his abode, and then come here and come to start training. Why can't he stay in one of the hospitals? The hospital is there to train. If you go to Germany, they have what you call the Krankenhaus. What it means is that it's a hospital which can teach.
Where most of your nurses are going to, we are told that a number of them are going to Germany amongst others, UK amongst others.
Yes.
But let's talk about some proposals. I know that the Nurses and Midwives Association, for instance, have sent proposals through you, through the Health Ministry, amongst others, for this issue about the car waiver. You know, in 2001 or so, they had that in place, plus the market premium. These are things that were frozen along the line. There have been proposals brought before the president, amongst others, for these to come back as a way of retaining some of these nurses. Where are we with it? Is it going to happen?
I thought you were going to talk about Agenda 111.
We'll talk about it. We'll talk about it. But these are
this is not the first
human
time,
resource issues.
This is not the first time we're having this type of human resource issue. You remember, in the early 2000s, we also have a lot of brain drain. People were leaving. We put in measures during Kofo's time. The same measures are being thought of, and we have to put in measures. The most important thing, we're talking about car waiver. Now, luckily, there are a lot of car companies in the country who are doing all sorts of cars. This is what we have started talking about, so that there's no need for car waiver, but there's a car that you can take from here, which to me is a brand new vehicle. If the scent in the car is different from when you buy a second-hand car from outside. It will not go for service. Apart from servicing, there will be no major servicing or major repairs for at least 5 years. And that's why, to me, every health professional needs. Every doctor needs a very good car. Every nurse needs a very good brand new car. And that's what we are talking about. We also have to make sure that all these hospitals that we are building, there are accommodations attached to it. But to me, there are few. So that we create what we call medical villages. The block of flats, every one of them.
At the various sites, at the various hospitals we're building.
It is even more important, especially for the rural districts. But there are some districts where do you get a house even to rent? So we're also making sure we're thinking about that, because we've started engaging a state housing company that is not only in Accra, Adenta, or somewhere that you have to continuously be building. They should also move to the district capitals. And you can have this block of flats within the enclave of the hospital, where they can even give some one side of the block for teachers. There will be a kindergarten, there will be a nursery there. And then we also advise and then encourage the district assemblies to have model schools. After all, when your children have finished JHS and they go to secondary school, most of them leave the house. And then you can have peace of mind with your wife, and then you'll be working. That's how people stay in villages and in other places for a long time. So this is one thing that we are also planning, and we are adding it to this Agenda 111. So these are things that we can do. If a nurse or doctor knows that if I move to this rural district, how to reach areas, or I'm in a faculty or a department where we don't have people, and they are given some incentives, they prefer it than sitting in maybe Okrampo or in Accra, where about 48% of the doctors are. So that they move out. You get the chance to practice. And especially where you are practicing, you have all the facilities, which are part of what we put into the Agenda 111. So that they are state-of-the-art of modern facilities with equipment that you can work with. So that if you want to do an X-ray, want to do ultrasound, you can do it in maybe Bunkrugu or Yoyo instead of coming to Accra. So you get job satisfaction. You are trained, because we are going to, all the things that we are going to do, there will also be digital. So that there's a kind of telemedicine aspect of it, so that you can even be trained virtually. Now, from what COVID has taught us, that you don't need to come and sit in the classroom in Korle Bu or in Komfo Anokye before you can train.
It's virtual.
You can do virtual training. And then if you have telemedicine facilities, you can even be assisted, even doing operation in a very remote area. And that is the way that we want to go. And I can assure you, what we did to retain doctors and nurses in Ghana during the early 2000s, the same thing can happen now. You don't have to reinvent the wheel. And that is what we have to do to keep the nurses at bay, especially the nurses who are going in post. And then the doctors want to do postgraduate as quickly as possible, so So recently, we had a meeting of the Ghana College of Physicians and Surgeons that there's no need for the 3 years before a doctor comes to do postgraduate. That they should go straight and do their postgraduate and do whatever they want to do. Those who are living are not those who have specialized.
Okay.
Only very few people who are specialized will live here. Because if you specialize here and you want to go to US, you go and take their
That's
course
all over.
again, all over.
Okay.
So
Well,
this is how we are going. I believe that we should be able to solve the problem.
Okay, I'm sure that soon, if we're ready, we'll go through the questions shortly. But one key concern, at least as part of preparations for this, when you were in the Ashanti region, my colleagues on the ground, they've been following this particular story. But one key hospital, 2 of them actually, the Syria Hospital, and then the Afari Military Hospital. I see you nodding because you know where I'm going with this. 85% completion for Syria, sitting in the bush. Afari Military Hospital, 95% completion, is also being shelved. And we are building in the district. Do we have a plan? Why are we not completing some of these projects that are almost, at completion point and leaving it and starting something all over?
Yes, I've been hearing this question over and over again. Now, why don't you use the money that we are using here?
Don't use the money. I'm not saying use the money. But these are 2 key hospitals in the Ashanti region.
Syria and Afari are projects which are funded externally. It's EPC plus financing. It's Eurojet Indexa, which is doing Syria and Afari. What I know about Syria is it's not 85%. Syria is almost completed.
95% you would say?
It's more than 95%. The actual hospital is completed. They've put in the equipment, they've tested the equipment. Ghana Health Service.
So why has it been abandoned? Okay.
But it needs a transformer.
A transformer?
Yes. Which I know was given to Ministry of Energy. As you speak now, the transformer building and everything has finished. I think they are testing it. What is left, another thing that we need to do in Syria is a road network to the hospital. So it becomes easy for patients to be carried to the hospital and also come out from the hospital. That one is also being given. The contract has been given out, is being done. So Syria is practically completed.
Okay. When will it be operational?
Immediately they commission the transformer and then connect it to the equipment. Because the equipment is such a way that if you don't have a transformer which will regulate the electricity to the equipment, then there will be a lot of...
But Dr. Nsia, sorry, what does it really take to get the energy ministry? Because it's laughable to hear that it's because of a transformer and then the road network. We've seen how roads sprung up in this country. In Asin North, it took how many days for roads to be constructed?
If people go there now, these are things which are being done and to be completed in the very shortly.
Okay.
Afari, the road network has been done, the transformer has been done. What is left in Afari and Asan is they've also fixed the equipment.
Okay.
What is left in Afari, the Ministry of Defense can tell you what is happening because the Ministry of Defense facility.
Yeah.
I think it's only accommodation and a few things which will be done.
Okay.
And this, we are all going around so that it can be done as quickly as possible and commission. We need those 2 hospitals. It has been there for too long. Those hospitals should have finished maybe before 20.
So it's a priority for
government. It's a priority for
government.
So you don't use the money we are using for Agenda 111 to go and finish that one. I want people to get it clear. That's what I'm saying. It's a project. And the contractor is on site and is working. And I'm concerned as you are concerned that it's finished. I'm sure you talk about Fomena. Fomena is completed. Fomena the equipment has been tested to be commissioned very soon.
Okay. Before the end of the year?
It will be commissioned very,
very soon.
Because, in fact, I'm sure they are planning with His Excellency the President to go there and commission it.
Okay.
And I know Ghana Health Service is getting people to go. Even I understand they've chosen people who are going to work there.
Okay.
The management and all these things.
Oh, okay.
Nurses which are being posted now, some of them will be posted there. And then other experienced nurses also will join them. Kumawu is also moving at a very fast pace. When we went for the Kumawu by-election, the day that we did the last rally, we went there with His Excellency the President, and we walked through Kumawu.
Okay.
The rate of work which is going on is fantastic, and we are hoping that before the end of the year, Kumawu will also be finished, and then to be handed over and commissioned.
Okay.
So these hospitals that we are building, they are districts without even if there is no district hospital in some of the districts, and there's no private hospital in that place, there are no doctors there at all.
Okay.
88 of the districts. So whose district should wait for Seria and Aferi to finish before they get a hospital? If you go there, I'm sure you see in one of the videos, when we went to Chufo Himai Denchra, the chiefs and the people follow us. They are so happy about it. Everywhere we go, when they get to know that we are there, they come there and say that we thank you. People, you see, the indirect jobs that has created in these areas is phenomenal.
Okay.
People there are getting jobs to do. You saw when we went around and they showed the pictures, the workers who are there working, and every day they get their money. So this is how it is. Okay. And I believe that let's put the projects into where they belong to, and then we make sure that we finish all these projects and hand them over and let the good people of this country get the use. And
you are promising that 22 other districts, because I hear you mention that which district should wait for one hospital to be built in another one before it will be their 10. So out of the 101, earlier we were talking about it, that at least 22 of them are also waiting their 10. I'm sure they would want to hear you tell them when exactly their 10 will come, because you say that it's in the west.
Anywhere we go.
Because they feel that you prioritized the other 89 ahead of them.
I'll repeat it again. The budget was, as at that time, the number of sites which...
But this was a 2023 budget.
Yes.
It means that's what the allocation has been made for.
Yeah, which were active. The sites which are not active, in fact, most of them, the 22 sites which are not active, I'll come in. The 22 sites which are not active, out of the 111, is because you are counting, are you counting the distance?
I'm counting the 101, the ones that you're supposed to be building, 101.
So the 22 which are not active, I've already told you 4 of them in Ashanti region.
Have come up. So out of the 22, yes. 4 out. Okay. Yes. How about the rest?
The rest we are going around. The rest, which will come out very soon, Ingrid Amount from Dansoman, Medina. For Medina, we can say that it has even started, because Medina...
You have land for...
We have land.
Okay.
We're having some issue of land gas, which you have sorted.
Even government is having issues with land gas.
Yeah, somebody will come there and go and put land gas. Police will go there and arrest them. And then that's why we are solving the Medina issue. Adenta have now gotten land from the Animal Health Research, where they demolished the land. They've given some to us.
Okay.
So if you look at all of them, and they are going to be the double stack buildings. So eventually, I'm sure by the time we finish in September, we will get all the places that we haven't started to start, so that there's nothing like prioritizing. But the prioritization, as I said, is according to how the contractors are working.
Okay. All right, let's bring in questions. I think that we've left our audience out for far too long. I'm sure some of the things that you've raised will come up again. Yeah, please, let's go through the questions, as many as we can go through as possible. This one from Kudia: why are we focused on building new hospitals when those that are 85% complete sit in the bushes and rot away? I think that's something we've been talking about.
They are not
rotting away, like you just mentioned, completed. Now, has the project timelines changed? The president first promised it will be done in a certain time frame and then move to the end of the tenure. Can all these projects be completed by 2024? ACN is asking. We'll take the questions and then I'll come to you, Doc. And Kay says the NDC minority has alleged so many of the facilities have been completely abandoned. What's the status of all the projects and their respective completion dates? And that's from Kumi. And let's go on. This one says, is there a dedicated source of funding, or this is GOG funded, and are all funds available now? Issue about funding. And Sefa says, can you provide an overview of Agenda 111 and its significance in Ghana's healthcare system? I think we've been speaking to it a bit. And Abba says, what are the specific goals and objectives of Agenda 111? How do they align with the overall vision for improving healthcare in Ghana? Lai, how does the government plan to ensure the sustainability and maintenance of the newly constructed healthcare facilities under Agenda 111? Maintenance. And Sule says, what strategies are in place to address the potential bottlenecks or challenges in the implementation of Agenda 111? So most of the things we've been talking about. So maybe we talk about the funding and then the maintenance of these projects once they are completed.
Yeah, the funding for the regional hospital, for the district hospitals and the psychiatric hospitals are government of Ghana funding. We are getting money from, first, you remember that we had 100 million from the COVID fund, which was used mainly for the startup as for the project. And then secondly, we are getting money from the ABFA fund. It's a percentage of the ABFA fund which comes in, and then there's a special purpose vehicle at what you call Health Gift, at GIF, which has been incorporated to manage the contracts and also the consultants. And I can assure you, if you like, I can call any contractor who has brought IPCs or interim payment certificates and has not been paid. Somebody is asking, is there dedicated funding? Yes, EBFA funding is there. Ghana government also is adding funding to it, and then we are moving forward. There's going to be, when there's a budget review, we also sit down with them and then tell them where we have reached. That's the reason why we are going around, to make sure that we know how much we need till the end of the year, to make sure that we can pay all our contractors and also pay for whatever we are doing. The other aspect of, for example, the regional hospitals is going through a process of procurement. That one will be EPC, external funding plus funding. We've gotten the contractors through the PPA. It will have to go through Parliament.
Okay.
And you know, the IMF condition came and then. But I'm happy to know that the IMF doesn't affect the health infrastructure.
Okay.
I think they are all happy.
So we have 100 million from the COVID fund, which started. The GIF, how much exactly are they giving?
All this money comes to GIF.
So you know, how much do we have? Because I know it's going to cost us about 1 point something billion for the entire project. That's estimated cost of 17 million. So how much do we have that money sitting down?
Any money you shouldn't have. You see, in this case, you don't have the money to sit down.
To sit down, okay.
It is when the contractors bring their work, and then you pay for it. That's why we are doing it.
Okay.
So anytime we need,
they are not in default at all.
They have not been default. So we are in constant collaboration with the Ministry of Health, the Ministry of Finance, and then also Controller, and with the ABFA. And I can assure you that maybe it's God. The way that we are getting money to finance and fund this project, it's sometimes I get a bit excited about it, because any certificate you get, we pay. That's what I say, that you see the 1.89 billion, part of it is also the equipment. Okay. And I've told you that we are going through other processes where we can get equipment. If you get equipment, please, you don't pay for it. Okay. You buy the reagents and then the kits and these things, and then the person knows that he can make the money over maybe about 3-4 years. Okay. If you get equipment lease, the government doesn't pay for it. It's when you go to buy the equipment outright. But when you are buying the equipment for 101 hospitals, say X-rays, if there are 2 X-rays or 2 ultrasounds in every hospital, nobody goes to the market and buy 204 X-rays at the same time. For it. So you get very high commission out of it. So instead of buying the X-ray maybe $50,000, you will not buy $50,000. Sometimes you can negotiate in such a way that the price comes down. Okay. So these are all the things that we are doing, and we are negotiating. We started talking. People who have brought in this thing, and then we will negotiate and get the best equipment at the right prices.
And then the maintenance.
The maintenance has been built. If you look, maybe you didn't have, if I would have gone through the facilities in the hospital, there's an energy center. Okay. There's a maintenance unit. Okay. There is a kitchen with a dining for the health workers. We build the hospital in such a way that there's airflow. You don't need to put air conditions at every place and keep it on. Light comes in, so electricity bills goes down. Okay. So if you look at the construction and the structure, the architectural structure of the hospital, we have taken care of all these things. So this hospital is going to be a place where maintenance, especially plant preventive maintenance, is going to be something that has to be incorporated in it. And I've also been telling Ghana Health Service that they should now try as much as possible to even try and put the management in place, get people trained. Now, it should not be business as usual. But this one, we want to make sure that the good people of this country get money for value, and then also get the hospital running for a long time. That is one of the advantages of doing placement or leasing. When somebody brings his X-ray or laboratory equipment into your hospital, you will let it, the turnover time should be very, very fast, because anyone that he brings in the reagents or the kits, that's where he gets money from. Okay. All right. So that's the way that you can make maintenance very
So to be
regular and then self-maintaining.
Okay, all right. Well, there are other issues that I promised that we'll be talking about apart from Agenda 111. There are a lot of questions on Agenda 111. I'm sure that as we go along the line with the videos and everything, we'll speak for itself. At least you are showing that by 2024, at least.
Yes, all what we have started
would have been completed. At least the 89
we'll clear them.
Would have
Those
been completed.
which are starting now, we will make sure that, because now we know the problems. So every contractor knows what is.
But someone was asking about the bottlenecks and the challenges.
So the bottlenecks, we now have learned the bottlenecks.
Okay.
We are over the bottlenecks.
The rocky areas and all that.
So we are over that one. So it's just going fast. And most of the contractors want money quickly. So they want their cash flow to be very. So some of them, we went to a place, they are doing double shift.
Okay.
Somebody, maybe I have to answer this. Somebody asked about the vision, if it is going to improve. Yes.
Improve healthcare.
We have to have healthcare to the doorsteps of the people.
Okay. So rural, urban, everyone.
Rural, urban, and then people coming to Kolebuko for no bed syndrome and all these things, so that there will be proper referrals. And the hospitals, the district hospitals, are the first referral centers for the CHIP centers and health centers and maternity homes. And because it's going to be a digital health system, the health information system are all digitized. You can also introduce, as I said, telemedicine and the training at the site, increase the number of people who are training in this country practically, and also make sure that people don't travel long distances to seek help.
Okay.
And together with improved health insurance, then we will have universal health coverage.
Okay. I have just about 5 minutes, and I'm hoping that we could cover a few things briefly before we go. So I know that these hospitals at least will be implementing National Health Insurance Scheme.
Yes.
And knowing the concerns that have been raised about the NHIS. I'm sure we are putting measures in place. What really is the status now? Everything is well. Extortion issues, non-payments of service providers, amongst others. Briefly.
Yeah, health insurance is solving all those problems. You know, if you change things and make it more digital, and payment is done digitally, and then renewal is done digitally, immediately you bring digitization into a system, you cut off all the fraud and also extortion.
Okay.
If you don't pay somebody, you don't pay the health professionals, the management, they will find a way of getting money to run the hospital.
Okay.
So these things are things that health insurance is sitting down with the hospitals.
Okay.
And I'm very sure that very soon they will not also shy away from de-accrediting some of the hospitals, even government hospitals.
Okay.
If you are taking money from the patients, it means you are not fit to be part of the health insurance scheme. So I know that health insurance is working around the clock. They are adding even more diseases to it, like childhood, sickle cell for child cancers and the rest.
Okay.
So with time, I believe very well that we are going to have a very sustainable and very resilient health insurance.
Okay. And speaking of child immunization, we know that in February this year, we had such a disgraceful situation that we were faced with as a country. There were shortages of vaccines, key vaccines like polio, a number of them, 3 of them, key ones that were supposed to be giving at birth, including BCG, amongst others. Have we resolved that situation? I know we got some from Nigeria, really.
No, there's also
have we changed the situation now?
Minister of Health have procured some.
And measures in place that we will not face that situation again.
We put measures in place. And that's the reason why we want to be a vaccine manufacturing hub.
Okay.
So that we have our own vaccines for vaccine sufficiency and health security.
Okay.
Because childhood vaccines are very important.
Key.
So immediately when you finish, all these are our factories that we are putting up. So,
but did any heads roll, considering that monies had been made available for them to purchase and it wasn't done? Nobody was punished for it?
I think Minister of Health is handling that. So allow them to handle it.
But you are the presidential advisor. If there's anything that happened, you would have known.
Yes, but I mean, there was some hitches here and there. But it was sorted out as quickly as possible. That's the most important.
And nobody was punished for it?
I'm not too sure if it's somebody's fault. I'm not very sure about that. But
that as a country, you are a doctor, and you know the implications of not giving vaccines to our children, key vaccines, and you didn't advise that anything happens?
No.
Because monies were made available.
The
UNICEF made monies available. NHIA made monies available for the payment.
If you look at the time that there was no vaccine,
who sat for it to finish?
It will not affect the immunity of the children so much.
If it wouldn't affect, you wouldn't be telling us to give it to our children, Dr. Nsiah Asare.
The action was taken immediately. And as you rightly said, they went round with the help of WHO to bring in even stopgap vaccines, and then our own vaccines came into failing. But as I said, the most important thing is that we learn from history, and we want to make sure that we produce our own vaccines, because going forward, that's what is going to happen. It happened during the COVID vaccine. Anybody who is producing it has to use it first when it's finished before he gives it to you.
Okay, but where is this $7 thing coming from? At the airport, we're told we're supposed to pay, but later I know that the Ghana Airport Company Limited says they were not supposed to, but we're hearing that it was mooted by the Ghana Health Service, $7. COVID is no longer there. Well, what exactly was it for?
I think I asked Ghana Health Service.
Did you withdraw because of public outcry?
It's something that, there was a discussion. There was nothing like a decision taken.
Okay.
That's why the Ghana.
But why are we discussing that in the first place?
No, I think there was discussion, because of all the infections and then the pandemics and this thing coming. People have to discuss things that will not introduce new pandemic or epidemic into the country.
Okay.
But there was no decision. So everybody is surprised that somebody brought it out at the $7 and all this. Like I'm sitting here with you and you are saying that somebody go and say, oh, he says this. I don't think it happened that way.
But
that's why the Ghana Airport Company has said that it's not true.
Okay.
Ghana Air Service said they have not given any instructions that this thing will happen.
But anthrax situation, is there a cause for concern? Is it under control?
Yes,
a number of animals are dying.
It's now mainly the animals which are dying.
Yes.
And then I know the veterinary service.
Still one person dead? One person or more?
I think it's only one person, one patient.
Okay.
I don't know if he's dead or not. I don't think.
We're told one person had died.
And now the rest are all it's animal issue which the veterinary service is dealing.
And it's under control.
It's under control. But I'll tell you something. Ghana, we have one of the most robust public health system in the country.
Okay.
But it's not only at the national level, not only at the regional level. It's also at the community level.
Okay.
And they are working together with the veterinary service and with all the other stakeholders.
Okay.
So we pick things very early enough to make sure that we continue.
That we contain the situation.
We have Marburg, we contain it quickly.
Okay.
We had also
monkeypox.
Monkeypox, we contain it quickly. And this is how our public health system is.
We should have you back. Thank you so much, Dr. Anthony Nsiah Asare. You plan on going back to the surgery, to go back to surgery anytime soon? No?
No, now
you don't miss.
Now
you don't miss
public
it.
Health person.
Oh, you don't miss surgery, do you?
I've done enough surgery.
Okay. All right then. Okay. Let's see how it goes.
Enjoy what I'm doing.
Okay. Thank you so much, Dr. Anthony Nsiah Asare. He is the presidential advisor on health. My guest on the probe. Thank you so much. For radio audience, we have a walk with Jesus. Have a good evening. I am Emma Fapao.
From the sandy pitches at the Indafa Park to the green fields and floodlights in Turin, in Istanbul, and to Vojvodina, where the career came to an end, we saw Stephen Appiah lead the Black Stars to the FIFA World Cup. That journey started on grassless pitch. Many say he's the man who redefined the Black Stars, what it meant to wear the Black Stars colours and represented the country, qualifying the country to the first ever FIFA World Cup in 2006, qualified the country to the 2010 FIFA World Cup, was part of the backroom staff for the 2014 World Cup. But one thing we all know is the light we see. But do we know how or where the switch was turned before the light came on for everyone to say it? We have no idea. And he's only the perfect person who can tell us how his life came to where it is now, that he's idolized by many people. Stephen Appiah, former captain of the Black Stars, is my guest today on Prime Take. Capito, how are you?
I'm fine. Yourself?
I'm doing good. I've not seen you in a long while.
Yeah, I can see that you are really doing good. You are looking fly.
Thank you. You see, there's one thing there. Is that there are many things people don't know about you.
Yeah.
But one of the things two people don't know about you is the fact that it is very difficult to get you, or very rare to get you to speak.
Yeah. Today I'm here. I'm in front of you.
So what are the other things that people don't know about you?
Oh, the other things. I think people know everything about me, but most of the things, I think, I mean, my Choco days, people doesn't know. I mean, people saw me playing for Accra Suffolk, from Accra Suffolk to under 17, under 20, and moved to Europe. And my career, that's where people know, but there are certain deep details that people doesn't know.
What are they?
And some of them, I think that I have to keep it for myself, because definitely one day I will write my book and I will put them in. So it should be a surprise. But I mean, I have certain deep details. Even though when I mentioned I was born in Choco, grew up in Choco, and when you know that environs, you have to know that, I mean, I've come from a long way. It wasn't easy, but yeah, I am at East Legon.
How would you describe that foundation?
How do I describe? I think I have to say that I've done well. I've done well. This is a place that I grew up, and people that you roll with were doing all sorts of things, but I never allowed myself into those things, and I said, okay, what I want to do is to play football. So I channel all the energy into football, and then it works for me. But I think that I've done well. I quite remember the Choco days when, as a kid, you wake up in the morning 4:30, you have to run to Kaneshie Market. Inside Kaneshie Market, they have these stairs that you have to climb. From there, you have to run to Circle. They have the stairs there. From Circle, you have to go to the Mortuary Road to the beach. So, I mean, these are the sacrifices that I did, and it works for me. Growing up, I come to realize that whatever we do is the passion and the hard work that takes you to the top, and that's what I did.
Talk to me about the days of playing at Indafa Park.
Yeah. Okay, so I attended St. Martin's School, and those days it was very, very difficult for me. I mean, at times as a kid, you go to school without no food. You go to school without money. So one day I was on my way to school. I walked from Choco to White House. And I was on my way, and I met a friend called, now he's a